Arcticum lapa is commonly known as burdock root. It's a popular plant in traditional Chinese medicine and is commonly promoted as a nutritive food. For hundreds of years, burdock has been used as a culinary ingredient, where it's normally boiled down into a soy sauce in Korea and Japan, and it's frequently ingested as food. Burdock is a strong antioxidant, and it can upregulate antioxidant levels and improve stage 2 detoxification. For example, in the brain, burdock increases antioxidant genes such as NRF2 and HO1. Burdock can be a strong or even stronger antioxidant than vitamin C. Burdock protects against lipopolysaccharide-induced inflammation. It can help with the removal and the protection from some heavy metals, like cadmium, in the kidneys, liver, can protect DNA damage and brain damage. Burdock can enhance mitochondrial biogenesis and fatty acid synthesis. For example, in muscle cells, arctogenin can dose-dependently increase adenosine triphosphate or ATP levels. It can also increase levels of cytochrome C and uncoupling proteins. Burdock may have anti-aging properties. For example, an ingredient found in burdock can increase the lifespan of worms by 25%. Burdock root can improve the levels of luteinizing hormone, follicle-stimulating hormone, and testosterone. It's a phytoestrogen and it can bind to the estrogen receptor, similar to selective estrogen receptor modulators, or SERMs, and it can act as a natural alternative to estrogen. Burdock root can protect reproductive organs during the use of the antibiotic gentamicin. It can also protect the testicles from cadmium-induced damage. In models of diabetes, burdock root was able to improve sperm count. Burdock can also help with erectile dysfunction and premature ejaculation. In animal models, burdock root can increase the frequency of sex and ejaculation, similar to Viagra. Burdock has anti-biofilm and antibacterial effects, similar to beta-lactam antibiotics. It has antibacterial activity against many strains such as E. coli, Heliobacter pylori, Klebsiella, Lactobacillus acidophilus, Salmonella, Schistosoma, Staphylococcus aureus, Staphylococcus epidermis, and many others. Burdock has antifungal activity against Aspergillus niger, Candida albicans, and Candida tropicalis. Burdock has antiviral activity against adenovirus, herpes virus, HIV, H1N1, and PCV2, among others. Burdock has antiparasitic activity against Schistosoma monsoni. Burdock can inhibit mast cells and reduce allergic inflammation. It can prevent IgE-mediated allergies as well as anaphylactic shock, and it can stop mast cell release of histamine and inflammatory cytokines. For example, arctogenin-containing latex gloves can prevent latex-induced allergy. In arthritis patients, burdock tea consumption of 6 grams per day for 42 days was able to reduce pro-inflammatory cytokines and improve inflammatory status and oxidative stress. Burdock root can improve diabetes by reducing blood sugar, improving glucose tolerance, and preventing pancreatic cell death. Chronic oral administration of arctogenin can lower blood glucose and can improve lipid metabolism. Arctogenin can decrease levels of HbA1c, triglycerides, and VLDL, while improving levels of insulin, HDL, and leptin. Insulin and cystosterol beta-D-glucopyranoside from the burdock can also help to positively regulate blood sugar levels. Arctogenin can reduce inflammation in the gut. Fermented burdock root can improve the levels of bifidobacteria in the gut. It can increase levels of organic acids, including lactate, acetate, propionate, and butyrate, and it can reduce fecal deoxycholic acid, a risk factor for colon cancer. Fermented burdock root can also improve levels of secretory immunoglobulin A and mucins, which are biomarkers of intestinal immune and barrier function, and it can reduce fecal litholytic acid, a risk factor for colon cancer. Arctogenin can also protect against the formation of ulcers and enhance their healing. The arctogenin can reduce the Th1 to Th17 ratio, induced inflammation in the gut. and it can help to prevent leaky gut and improve tight junctions in the intestinal barrier. In multiple studies, burdock and its components have shown to improve physical performance and endurance, to reduce physiological fatigue, and to improve grip strength. For example, arctogenin increases exercise endurance by increasing antioxidant levels in the muscles and reducing fatigue from exercise. Chronic administration of arctogenin in animal models was able to significantly enhance swimming endurance by activation of the AMPK and reduce fatigue by 30%. Arctogenin is so strong at reducing exercise-induced fatigue that it was able to improve exercise endurance during treadmill running in full sedentary animal models. Burdock also reduces the levels of lactate, ammonia, creatine kinase, and BUN in the muscles. And the arctogenin can also reduce fatigue by its ability to increase dopamine in the brain. Burdock protects the liver against oxidative stress by helping to increase its levels of antioxidants such as glutathione. Burdock also increases cytochrome P450 activity, helping to alleviate the severity of liver damage from some toxins. It can also help to reduce levels of ammonia. Burdock can also help to protect against cadmium-induced liver damage, while caffeic acid in the burdock root can prevent against nickel-induced liver damage. Burdock can also prevent liver damage from acetaminophen or Tylenol overdose. Arctin in the burdock can help with fibrosis and scarring in the liver. In the kidneys, arctogenin can reduce inflammation and increase antioxidants. It can prevent oxidative stress during kidney infections. It can prevent and reduce fibrosis of the kidneys. It can also help to treat urinary tract infections. Arctogenin reduces neuroinflammation or inflammation in the brain. It can polarize M1 macrophages to M2-like macrophages, turning brain cells from a pro-inflammatory state into an anti-inflammatory state. It can also activate silent information regulator 1 or SIRT1 signaling in the brain, thus helping with neuroinflammation. Chlorogenic acid can prevent neuroinflammation from heavy metals like metal mercury. Arctogenin has therapeutic efficacy in experimental models of influenza virus and Japanese encephalitis. The arctogenin can reduce viral load and viral replication within the brain. It can reduce neuronal death and reduce secondary inflammation and oxidative stress resulting from microglial activation. Arctogenin can improve movement by upregulating dopamine and GABA levels, therefore it may prevent the development of Parkinson's disease. Burdock can help with excitotoxicity. For example, in the brain, arctogenin can protect the hippocampus from glutamate-induced toxicity by binding to kainate receptors. Burdock root can protect brain cells from neurotoxicity and cell death after alcohol intake. Burdock can also protect against alcohol-induced liver damage. Burdock root can protect the brain during a traumatic brain injury and a stroke. After an ischemic stroke, arctogenin can reduce neuroinflammation and stroke damage size. It can reduce the swelling of the brain after subarachnoid hemorrhage stroke, decreasing the brain's water content in a dose-dependent manner, and improving a leaky blood-brain barrier. After a stroke, arctogenin can accelerate the rate that the brain heals and reduce the levels of lactate dehydrogenase in the brain. Arctogenin can improve memory in models of Alzheimer's disease. One way that it does this is by its ability to increase the neurotransmitter acetylcholine in the brain via the inhibition of the enzyme acetylcholinesterase. It can also help to promote the clearance and reduce the buildup of beta amyloid-induced neurodegeneration and prevent hyperphosphorylation of the tau proteins. Arctogenin also improves autophagy in the brain, or recycling of brain cells by inhibiting the mTOR pathway. Arctogenin in burdock root is a potent anti-tumor agent. It's shown anti-cancer activity against bone cancer, brain, breast, cervical, colon, gallbladder, leukemia, liver cancer, lung, pancreatic, prostate, renal cancer, skin cancer, and stomach cancer. In prostate and breast cancer, the arctogenin synergizes with the polyphenols like quercetin, green tea, and curcumin. The burdock can increase chemosensitivity in cancer cells and lower chemo resistance. In phase 1 clinical trials, a specific extract from burdock can make the cancer cells more sensitive to glucose deprivation. Eating burdock root can help with weight loss. For example, in an 8-week study, a repeated oral intake of burdock root resulted in body weight decrease and blood glucose suppression. The arctin is able to reduce the weight gain in animal models fed a high-fat diet. It can also increase brown fat, fat with more mitochondria, while reducing white fat accumulation. Burdock can improve skin aging, elasticity, and collagen synthesis, and reduce wrinkle formation. For example, the burdock has shown to increase the levels of antioxidants in the skin, and is able to inhibit elastase and tyrosinase. It can reduce the action of alpha melanocyte stimulating hormone to induce melanin production in the skin. In a clinical trial, burdock was able to improve the symptoms of acne vulgaris. Burdock can help to increase wound healing after burns and help to prevent infections. The polyacetylene ingredient in burdock can have potent antibacterial and antifungal activities in some skin conditions. The arctin can potentially protect the skin cells from UVB radiation, and it may be useful as a sunscreen alternative. Burdock can be useful in treating tooth and gum disease that's related to microorganisms in the oral cavity. Arctin can improve heart function and prevent the enlargement of the heart. Burdock can help with hypertension, as ligands found in the burdock have shown to be potent platelet activating factors, receptor antagonists, and calcium antagonists. For example, in animal models with hypertension, the burdock can reduce blood pressure. The burdock can help with atherosclerosis and cholesterol buildup, similarly to simvastatin. Arctin has antioxidant effects on hair follicles, and it may be beneficial for alopecia prevention and treatment. The arctin can help with oxidative stress from lung infections. Other constituents in the burdock can help with tuberculosis, and the burdock can help with pneumonia and influenza. Arctigenin in the burdock protects against hearing loss by enhancing survival and growth of neural stem cells in the ear. Burdock root has been shown to be safe in animal studies in up to 8 weeks of consistent consumption. The tannins in it can cause stomach upset, and the high concentration has some dangerous side effects such as nephrotoxicity and hepatic necrosis. Burdock oil can cause dermatitis when applied to the skin. Metabolites of burdock root may be excreted via bile and urine. For more information about herbs, supplements, and natural treatment plans, check out my website.